Let us put our hands together and welcome Dr. Filtzer. Good evening to you. You're in the US,
Evening.
and I think most of us in Asia. Good evening. Okay, I'm going to pin you so everyone can see you. Welcome, welcome. I'm excited. I don't know about you. I'm so excited.
Well, I'm happy that you are. I have to say, I am as well. It's kind of exciting to think that today is tomorrow where I am. So it's kind of cool.
Yeah. I think all of us have seen many of your YouTube videos. We enjoy all the videos because it sheds so much light to what we have been drinking, what we are doing, and it really boosts our confidence and raises our conviction in sharing this amazing water with everyone. But I think everyone is curious also. How did you first come across Kangen water? Did somebody introduce you? How it started?
Well, it's very, very interesting. I operated on a man in Arizona who surprisingly was a classmate of mine in college. We didn't know each other, but we were the same year in college and graduated at the same time. And I fixed his aortic aneurysm, which is kind of a big operation. And he was from Las Vegas, and I wanted him around to make sure that all was well. So I told him to stay a week in Bullhead City in Arizona. And he had no place to stay, and I was living alone in this big house of mine. So I said, well, come and stay with me. He produced this funny looking machine I had never seen before. And he said, Doc, do you mind if I hook this up to your sink? I said, knock yourself out. What is it? Well, it's a very special water and it's good for everything and what have you. And I said, well, fine. I'm not much of a water drinker, but there we go. So I tried it. And I have to tell you, it was an instant like. I liked the way it tasted. I also liked the way it didn't make you feel all full and what have you. And I really enjoyed the taste of that water. And Arizona, where I live, has terrible water. We have very hard water. We have all kinds of issues with it. So I bought a machine from him. And the rest is kind of history. I've been hooked on it ever since. And I met a number of people. I met Chuck Thomas, I met Fred Brown, and so on. And I got more and more interested in it. And they said, would you do a testimonial? Testimonials were big in 2008. That's exactly when that was. And so I made this video. It took 15 minutes to make the video. I never thought much of anything else. Next thing I know, they asked me if I would be medical advisor to Kangen because I liked it, you see. And so that's what happened. And I became a medical advisor and I gave talks on the efficacy of the water and so on. But what struck me was the fact that there was so much what I have to call unscientific knowledge. In other words, the water did this, the water did that. But when I ask what is the mechanism? For example, how does it become an antioxidant? How do you know that this water, when you drink it, is transformed into something different within your body? The fact that you put a probe in a test tube and you measure a pH or an ORP, it doesn't mean at all that it's going to do anything inside your human body. And it took me, 7 or 8 years to get an appointment with Mr. Oshiro. And I said, sir, you need to do some studies to verify, to actually prove that when you say this water is an antioxidant, it doesn't make a damn bit of difference if you can't prove it that it is an antioxidant in your body, first of all, the regulatory agencies in this country and in Malaysia and in Singapore and in a number of other, because all of this has happened elsewhere, these regulatory agencies demand proof. The Federal Trade Commission here demands that when you say, this water is going to be an antioxidant, that you can prove it. And we couldn't. We couldn't prove it. So obviously, money is always a big consideration. So I suggested that we start out testing the water in human tissue culture. And the reason for that is money. Tissue cultures you can buy. Tissue cultures can be incubated with the water. Tissue cultures respond like all other cells do. And these are human strains. And so we were able to do the first study that showed that in red cells deprived of antioxidants, this becomes a powerful antioxidant. And we could actually show that. And we compared it to local tap water in the community where the tests were run. And there's no question about it. Kangen water differentiates itself in tissue culture as being a more potent antioxidant than tap water. That was number one. And then number two, anti-inflammatory. All this talk about how people have less back pain, how people have arthritis improve, and this and the other. Again, no proof. Well, we used neutrophils. Those are white blood cells that are part of our immune response. And these white cells showed indeed that this water is a potent, measurable, direct anti-inflammatory agent. And as a bonus, which we had not actually intended, we found there was a new test that could measure mitochondrial activity. Now, a mitochondria is called an organelle that is within a cell. It's like an organ inside a cell. And this is our machine. This is our energy-producing organelle. It converts glucose and other things into ATP, which is energy. And what we did, we incubated this water with the mitochondria and found a substantial upregulation of the activity of the engine. Figure it, your normal engine runs at 500 RPM. Well, with this water, it cranks up to 1500 RPM. So it produces more energy by making these mitochondria work harder. Now, you have to have a substrate. You have to have glucose. You have to have amino acids. But there you go. And those were the three things that we first studied and showed. And that was for short money, relatively, $10,000 to $15,000, not a gigantic expense. But now we wanted to see, what does it do in a walking, talking, living human being? Can we show that there is that same antioxidant effect, that same anti-inflammatory effect, etc.? So we studied 13 healthy volunteers in a college town in Oregon. So they were readily available, and they were going to be studied after undergoing stress, an exercise stress study. In other words, we wanted to exercise these young people. We wanted to stress them, and we wanted to see if the water acted differently under stress than ordinary tap water. It was actually kind of an easy study in a way, because the oldest person, I think, was 28, college students. We put a machine in their room, and the first study included all the participants, and they were stressed in a standard garden variety exercise program. They had their blood drawn every 15 minutes. They had all kinds of physiologic measurements made. They had their plasma, their serum, and all that saved for future study. And this test lasted about 40 minutes. They would do push-ups, sit-ups, so on and so forth. Lactic acid was measured. And they were their own control. What they would do is drink Kangen water for 2 weeks, every day, about 2 to 3 liters. And then we would run the testing and run the stress test. Then they would go away for a month and repeat the same thing with ordinary tap water, non-Kangen water. And when we analyzed the data, it was crystal clear that the exercise-related stress was handled much, much better by the Kangen group. Their red blood cell count went up. This is very important if you think about athletes, or particularly runners. You know, I'm from Boston, and we have the marathon. And every damn year, the Kenyans win it. Why? Because the Kenyans live at 10,000 feet in Kenya. They're skinny as a rail. They're 6.5 feet tall, and they train way up in there. And when they come down to sea level in Boston, they've got such a huge advantage of red cell mass alone. Not that they're not good athletes to begin with, but you understand that why they win. And this is what was happening with athletes drinking Kangen water. Red cell count went up. In addition, there were markers for inflammation, white blood cell count, that went down. They had less inflammation. Consequently, they reported less pain. Consequently, they reported less fatigue. Consequently, they reported quicker recovery from all of this stressful situation. Also, we did what we call psychometric tests. And these are designed by the American Psychiatric Association. They're questionnaires, but they're valuable, and they are, in fact, helpful. What happens is the people are asked how they feel, and there's a score. It's like, you know, a frown and then a smile, that kind of thing. But overall, it takes quite a bit to fill out one of these tests. The people who drank the Kangen water got over the joke much more quickly. Their vigor returned more quickly. 5 days later, they didn't even know they had the test. They don't have any aches and pains and so on, as compared to the non-Kangen water. And then we were left with this huge amount, 60 vials per person, of serum and plasma in the deep freezer, not analyzed because that's very expensive. So that brings us up to the first book, which I think you have. I reported that for people to understand it and to be able to say to their prospective clients or their prospective buyers, listen, this is real. This is not phony. These studies were done, and they're scientifically solid, and they were done in an NIH and federal government approved laboratory with a stellar reputation. And then the next step, and that's where we had issues, and I'm not going to get into them, it's not worth it, financing. The company didn't want to spend, because those tests are very expensive to do all the analysis. And it was an analysis for tissue factors and cellular factors that show inflammation, non-inflammation, and other things. And they're called cytokines. We analyzed these cytokines. We analyzed a total of 32 cytokines, but only about 14 of them reacted in any shape or form to the water, which is understandable. Not every cytokine reacts to water. Specific ones do. And the bottom line is as follows. There was a marked increase in anti-inflammatory cytokines. What that means, inflammation was decreased. Anti-inflammation was substantially reduced. Again, when compared to the regular water. In addition, we also found that cytokines that ordinarily produce inflammation, their number was reduced. So anti is up, and inflammatory is down, and that's profound. But then the greatest surprise was there's an enzyme made by our body. It's made.
I think you are, one moment here, I think, hold on, let me, wait. Okay, you try now. I just, can you try unmuting again? I just sent a request for you to unmute. Yeah. It's not working. Okay, let me send again one more request for you to unmute. Can you try now?
ഒരു കപ്പ് വെള്ളം കൂടി എടുക്കുക.
Because on my end, I can only send a request. I'm unable to unmute you. Okay. Maybe what we can do is, Dr. Filtzer, in this case, can I trouble you to perhaps exit and come in again, and you see how it is? Then all of us just be patient and wait for a couple of minutes. You think it's better? Let's try that. Because I'm unable to unmute you, despite the fact that I sent several requests for you to unmute yourself. So if you can hear me, Dr. Filtzer. Oh, okay. I think it's fine now.
I found the secret. Okay.
Oh, yay! Welcome back to our part
So sorry. So sorry. So anyway, the thing I believe I was saying that we found a surprise in that the human body makes the most powerful antioxidant known to man. It's called superoxide dismutase. This is an enzyme produced in the liver that is extremely powerful in taking reactive oxygen species or free radicals and containing them, particularly things like in the lining of our arteries and our intestines. This is where, for example, they counter atherosclerosis. They counter rheumatoid arthritis. They counter these, and this is a very powerful enzyme. And we found that this enzyme is 2.5 to 3 times increased over baseline enzymes in relationship to regular water. And that is huge. That is so huge that I think it's really important that we go on and follow this up with appropriate studies. And I've suggested that so far between the pandemic and everything, I'm not getting very far, but I'm going to keep plugging that because, number one, we ought to be able to study patients very easily who have arthritis. I mean, arthritis is so common, particularly in the Western Hemisphere. I mean, rheumatoid arthritis and degenerative arthritis is exceedingly common. And we could study that and we could show, and I'm convinced that we would be able to show that these folks that really take the Kangen water drinking seriously will benefit from the point of view of having less joint pain, less inflammation, less downtime, and a better sense of well-being. There are also a number of things that have been suggested in the literature in relationship to electrolyzed reduced water or ionized water. One of them is longevity. Now, there's all kinds of funky literature out there about the Hunza people who live forever. They don't. They go by a lunar calendar, so when they're 130 years old, they're only 70. But that's neither here nor there. That has been around the literature for centuries. And it's because they drink glacial water, and glacial water actually is ionized because of the piezoelectric currents that are produced by glaciers. But the point is we can measure whether or not something affects aging by studying two things. One is the telomeres, and the other one is the primary response of primordial cells, stem cells specifically. Even when you're 80, which I'm damn near, your stem cells response dictates how long you're going to live. If at the age of 80, you don't have much of a stem cell response, you can say sayonara, auf Wiedersehen, goodbye. You're going to die soon. But if it's a good, healthy response, you're not. And these are all things we can measure as hard data. Imagine showing that a group of people who drink Kangen water for a year can show telomere lengthening or a better, and those things, and they're easily to study. I mean, they're expensive. On the other hand, the company makes a pretty good buck. So I'm hoping to encourage them. And I've presented these suggestions to Japan. This March, I actually personally went and met with Mr. Oshiro. And I'm confident that as soon as this pandemic sort of gets under control, we'll be doing more of these studies. And if it's not me, someone else, but it really should be done. Because if you do research to validate your product, you're one step ahead of the competition.
Yes.
I can tell you, it's going to be in the book. It's just a short paragraph. But in 1936, Mercedes-Benz built a diesel engine. Now, diesel engines are actually older than regular engines, but they built this diesel engine, 4-cylinder engine. That same engine is still alive and well today. Why? Every time they turned around, they tried to make it better. And they made it so good that it is the most common diesel engine powering trucks in the world. No competition. So I guess I'm saying we must continue to do research. And as long as I'm around, I would like to be a part of that. And I'd like to tell you guys about it. So there.
Wow. Thank you so much, goodness. You will be around because you have Kangen water. Yes, you're going 80, but we look forward to more of your research and your good work coming up. So having heard what you said earlier about anti-inflammation, about the mitochondria, can you help us understand better? For example, you mentioned about liver that we understand very well. But for example, I know we are not supposed to make claims here, but
right.
Let's say a diabetic patient, all right? A diabetic patient. What you have said, how do we translate into diabetic patients will actually benefit from drinking Kangen water? Not that it will cure, but how will what you have said translate to better health for diabetics?
Well, what I do when people ask me, you claim my diabetes will get better. I said, well, it may or may not get better. It depends upon your diabetes because everyone in that regard is different. But I think someone with the type 2 diabetes has a good chance to improve because there is inflammation in the pancreas in relationship to the islet cells. And hydration is also, we haven't talked about that today, but that's a big part of Kangen, the increased hydration that you get. So when you hydrate the pancreas, when you hydrate that gland, it functions better. And type 2 diabetics make their own insulin. So there you can immediately see that if you improve the blood flow through that pancreas, it's going to crank out better and more insulin. And if you kind of watch your diet a little better, you get an extra bonus and you lose weight and you feel better. So that's not difficult to explain at all. Can it cure diabetes? Hell no, it can't. Why can't it cure it? Because you're born with it. Your genes you have a diabetic genes. As I tell my kids, my daughters and my other children, that you can pick your nose, but you can't pick your parents. So your parents determine what your genome is, and that's the way it is, right? If you're unlucky and you have type 1 diabetes or juvenile diabetes, it's a tough thing to treat for any agent. But good hydration, water that's antioxidant, water that's anti-inflammatory. It is impossible for me to think that can't do you anything but good.
Thank you.
And
yeah. Well, that really shed some light because people really cannot relate how it will help, and they are often being asked this question. That is really, really useful. Now, another question I have for you is, in fact, I have a friend who has some stomach issues, and she has the Kangen machine. She does, and she said her doctor tell her for her condition she cannot drink alkaline water. It will disrupt her stomach acid. So with the Kangen machine, she is drinking pH 7. So some people have the perception, or some doctors have the belief that drinking alkalized water, in other words, Kangen water, it will affect their stomach acid. Can you tell us the truth or shed some light on what actually happens when we drink Kangen water?
Okay. When you drink Kangen water, it hits your stomach. And because it is different and is microclustered, it starts being absorbed in the stomach. Tap water goes all the way through the duodenum before it gets absorbed. So you have that advantage. Absorption starts in the stomach. And these naysayers who say that, well, your stomach acid will mix with the water and neutralize it, they didn't attend the course in physiology of the stomach when they went to medical school. They weren't there for the lecture, or they forgot about it, because the resting stomach has a pH of 4. The resting stomach has no significant acid in it at all. The resting stomach has a mucin coverage, like a mucus kind of cover, all over its parietal cell mass where the acid is produced. And water does not trigger acid. Now you chew a steak, and when that meat juice gets into your stomach, the acid comes out like gangbusters, because you need that. That is a trigger. When you drink alcohol, the stomach makes more acid. But the stomach doesn't do anything to your Kangen water, because that's what it is, water. So your water goes in, absorbed in your stomach. That's why you get the pH factor into your blood. You have to get that water into your bloodstream to come into your cell. And so we know that it does that because it produces all of these.
Yeah, yes, absolutely. Thank you so much. I'm going to share this good news with her because she's still drinking pH 7 despite having the Kangen machine. What a pity. Yeah. Another question I think a lot of people would like to know is, we would like you to also shed some light on cancer patients going through chemotherapy or radiation, drinking Kangen water, because when they have the big C, they are very careful about what they put into their body. And also there are doctors who tell their patients that alkalized water or antioxidant is bad for them. It will interfere with the results of the intended chemotherapy, etc. So what's your take on that?
Well, I tell you what, if you remind me, Judy, I'll send you a PowerPoint of mine. I did this a long time ago, because the fact of the matter is that the chemotherapists, that the oncologists, people treating cancer victims with chemo and whatever, is to make a point that you shouldn't do antioxidants because it'll interfere with the chemo. And I've done the research and I've done the papers and I've looked at all this, and it's total bunk. It's not true. it is simply not true that antioxidants interfere with chemotherapeutic treatment. Now, in some cases, like ovarian cancer, it's actually helpful to take antioxidants. But the benefit of Kangen water in relationship to chemotherapy is a little more subtle than that. People get sick from chemotherapy. They vomit, they have nausea, they feel lousy and what have you. Hydrating oneself significantly before getting the chemo helps tremendously in reducing the side effects. And there are a number of very, very, very prominent clinics in the US right now that actually encourage people to drink the Kangen water because it reduces the nausea, it reduces the vomiting, and the hydration. You know, when you vomit, you get dehydrated. And when you get dehydrated, you vomit more. So you need to reverse that vicious cycle, and the water is excellent. Does it cure cancer? No, I wish it would, but it doesn't. But it certainly ameliorates symptoms and makes them better.
Fantastic. Yeah, that totally makes sense now. But moving forward, so alkaline water, alkalized water, and many other ionizer brands in the market. Can you maybe first explain the difference between the regular alkaline water or water in an alkaline state compared to Kangen water? And then the Kangen machine, why is it so? Of course, we all know as distributors, because of the ISO 13485 is superior to other ionizer, but for yourself, you are being introduced to the Kangen machine by your patient, but have you actually tried drinking water from other ionizer brand? And if you did, how does it feel different to you? So sorry to do so many questions at one time. So
well, actually, it's a very basic question.
Yeah. Okay, great. Thank you.
Yeah,
Thank you.
It's a very good question. Let's say, first of all, alkaline water. I define that as a stable alkaline water. In the United States, virtually all tap water is alkaline because we have metal pipes and they don't do well with acid water. And certainly when it comes out of the ground, for example, in the Northeast, Washington State, Oregon, and what have you, the water is extremely alkaline, some places as much as pH 10.3. Very high alkaline. But that water is not ionized. It's stable. It's stable. And therefore, it does not have that energy that alkaline ionized water does. The ions are what gets and imparts the energy to the cell that then produces better cytokines or different cytokines, reduces inflammation and so on. It is that aspect, and I call it a living water because it has a birth in the machine where its ORP is high, where its pH is perfect on the nose, and then it decays. Now, the decay is over time. So when you drink it fresh, you get a fresh attitude. If that did not happen, you could overdose yourself easily. But there's no way you could over-alkalinize yourself with Kangen water because when you drink it, it decays over time. Okay? Now, if you were to drink too much alkaline water, ionized water, you would not change your pH, but you would change your serum sodium because water is hypotonic. It has less sodium than your serum, than your blood. What that means is if you drink too much, you get water intoxication. And that's a real issue, and it's real. If you just go on a binge and drink too much water, you can actually kill yourself. Because when the sodium drops below 120 in your system, you start getting funky things like nervous conduction problems, seizures, cardiac conduction problems, tachycardia, bradycardia. and you can die from that. Not so with ionized water, because that water, the more you drink, it only affects your pH. It doesn't affect your pH. It balances your pH. Got it? But it can lower your sodium. Okay.
Okay. Okay. So the second part of the question is, so besides the Kangen machine, have you experienced drinking from other ionizer machine?
Oh, good. Yeah. I was in court on behalf of the company in Texas a few years ago. When one of our competitors said that, we're making false claims, we were lying through our teeth, and their machine is just as good as any other machine. Well, of course, it's bunk. It's not true. And the reason it's not true is because they don't have, first of all, they don't have the plates. They don't have the technology. And none of these, and I've personally tested myself a number of them, they can't crank out the same ORP. And the ORP is key. You need that energy to give you that right pH. You need that energy to give you enough of those ions to circle around. And the beauty of our machine, and I'm not going to name anybody else or get into, is that we have an ORP that is powerful throughout the cycle when the machine is used. One of the machines we studied would have an ORP of, say, 500, okay, when you started it. But 5 minutes later, while the machine is running, it'd be 100. You take a Kangen machine, an hour later, it's still 500. That's the point. And that's why we are, without any doubt, number one. Number one.
Yeah. The stability is there. The amazing performance of the engine of the Kangen machine is just superior to everything in the market. Thank you.
Yeah. Needless to say, you got to take care of it. You got to, clean it every now and then, but no question, superior to anything I've studied.
Thank you. Okay, now moving on. Can we talk a little about the strong acidic water pH 2.5 with the positive ORP of more than positive 1100 or 1200 for wound care? And perhaps you can share your experience on the efficacy and the use of pH 2.5 from the machine, from your experience. Because as you are a surgeon yourself.
I have to qualify that my experience with 2.5 pH water is over 12 years long. And I used a super SD501 because obviously with 2 extra plates, it really cranks up a positive ORP. Mine would routinely do 1,300 positive ORP. And I used it in a wound care clinic very successfully. My results were superior to most people in wound care because I used it for direct dressings of wound, for cleaning of wounds and what have you. And again, it's because that powerful ORP kills every known bacteria to man. I have the data, it's been tested, and it's also been tested according to the EPA, that's the Environmental Protection Agency, as a surface sterilizer and sanitizer, and it passes all of those tests with flying colors. And so don't ask me about the coronavirus, only because I can guarantee you it would work against the coronavirus better than anything else, because viruses are much easier to kill with hypochlorite ion than bacteria. Bacteria are used as the gold standard. And this machine passes the gold standard for surface sterilization and ionization. So that's point number one. The other thing is that because the water, again, decays, 2 hours later, your ORP coming out of that, you take a glass of water, put the 2.5 in it, measure the ORP, measure it 3 hours later, and it will be lower. And that's why it is a superior product for human tissue, because at that point, it does not damage tissue. If you had a stable compound, 2.5 pH, hypochlorous acid, over time, you would get a clean wound, and then the wound would deteriorate because now it's actually toxic to the tissue. Kangen water 2.5 is non-toxic to tissue. You can put it in your mouth and rinse your mouth. It doesn't burn your tongue. If you do that with ordinary hypochlorous acid for a week, you're going to have a raw mouth. This is the wonderful thing about that. And it is an excellent sanitizer and sterilizer. In a mist, when I was in Japan, there were several machines that were misting 2.5 pH water in the lobby of different hotels to use as an antiseptic spray. It's perfect.
Fantastic. Yes, very, very good. I have two more questions before I go to Q&A. So if you, Dr. Filtzer, if you were an Enagic distributor like us, what are the top 3 aspects that you would promote to a prospect in the general public in regards to Kangen water?
Well, I think, first of all, I would narrow down on what we know for fact. We know anti-inflammatory. We know antioxidant. We know upregulation of cellular activity, cellular function, mitochondrial function. We know superoxide dismutase. We know a variety of cytokines that are measured and actually have been shown to do what we say they do. Increased red cell production, increased energy production, reduction of fatigue, sports recovery, much more quickly. Those are big things. And I can tell you, you can also sneak by and say, you drink this water as an athlete. It does a great deal of good for you. It balances your pH, increases your energy. And guess what? There are no funny aniline dyes in it. I don't know if people are familiar with I'm sure you're a Gatorade. I mean, it's one of those.
Yes.
That they win a football championship and they try to drown you with it.
Yes.
But the point is, that has aniline dyes in it that are cancer causing. And it has sugar, and it has fructose, it has all kinds of garbage in it. Body doesn't need that. You may need it if you were doing long-term exercise, but sprints and stuff like that, all you lose is water when you sweat. You don't lose sugar or anything like that. And you replace that water that helps your pH get back and governs it more tightly because acid is produced with exercise, right? Lactic acid.
Yeah, that's right.
So talk about the facts and then mention that many people report that they drank the water, they lost a bunch of weight. And then you can elaborate on it. You can say, we've heard other reports to that. We're not claiming anything, we can't prove that, but anecdotes are okay. You just can't say that this is what you're going to experience because you don't know.
Yeah, everyone is different. Yeah, that's right, absolutely.
And what you have now with the new paradigm is you have an ammo in your hand that says, hey, I can prove what I'm saying.
Yeah, exactly. All that Dr. Filtzer has just mentioned, all the benefits is actually, it can be found in the book, very nicely and detailed lineup. So really good. Now, some time ago, I think, correct me if I'm wrong, you had mentioned there was a couple of projects planned to get beauty water classified as an astringent and pH 2.5 as a sterilizer or sanitizer. So can you please give us an update on these initiatives of yours?
Yes, well, the FDA started started to rule on our machine, SD501 and K8, almost 2 years ago now. They're still playing around with it. We still haven't got a ruling one way or the other. One of the first issues was how to classify the machine, and we're still kind of in with that. But there is no question that they are very interested and they're not against producing it. We just have not shown them enough documentation. We have not shown them enough documentation for the SD501, for example, because we don't have any studies on it vis-a-vis the acid was. And one of the big claims, if you look at it, is you can sterilize a toothbrush with a 2.5 pH. Well, that's a claim. Well, we don't have any study to prove that. So we're trying to catch up and give the FDA what they need. And with the pandemic, let me tell you, 2/3 of the government people are at home and they're not doing anything.
Yes.
Fact.
Yeah, that's right.
But we are actually working on that actively.
So we're looking forward to more of your good work published. Now I will go to the Q&A where Sinjo has picked up some questions in the chat. First question is from Winston in regards to water intoxication. But of course, you mentioned that that will not happen with Kangen water, but only with regular tap water, But what is the guide? How much is too much? Not Kangen water, but tap water.
Well, first of all, you can get water intoxicated from Kangen water.
Okay.
Yeah, water intoxicated. You just can't get over alkaline. Okay? Your pH is not going to change. I want to make that very clear.
Thank you.
What's too much? It has to do with the body weight. It has to do with your body's mineral reserves. Like if you're old and your bones don't have much density and minerals, then of course it's more quickly. What water intoxication does is it dilutes your serum sodium, because let's say the water, Kangen water, serum sodium is 90 at best, maybe even less. Your own is 140. When you drop it down by drinking too much diluted water to around 120, your mechanism, your homeostasis, your electrolyte balance in your blood goes awry, and you can get cardiac arrhythmia, you can get seizures, you can get all kinds of stuff. So it's strictly related to body size, it's related to your reserves, but I would say when you go over 3 liters and you weigh 70 kilograms and go beyond 3 liters, you're starting to be in dangerous territory. Now, if you happen to weigh 220 or so on, you have a bigger room to store that water extracellularly and be in that. But there was a big case in Sacramento, California, many years ago. They had a water drinking contest. And some young woman drank herself to death. She won, her family won a gigantic lawsuit because she drank so much water and had a seizure and died. So the family got $28 million. So it's real. Water intoxication is real.
Okay, got that. Everybody, did you hear that? So be careful and watch your weight in proportion to what you have to drink. Do not overdrink for sure. Another question. I'm not sure if I can pronounce her name right. Yogis. The question is, for chemotherapy and radiotherapy patients, can they continuously keep hydrating with pH 9.5 while undergoing treatment to boost their cell hydration, as well as getting the kidneys to excrete out the chemo medications faster?
The answer is unequivocally yes. Unequivocally yes. They can absolutely do that. Now, let me sneak in another little observation. I used to see a lot of women in my clinic, my wound care clinic, who were undergoing radiation therapy for breast cancer. And radiation is like sunshine. You know, these red-headed, pale white women really get affected badly by that radiation. Their skin, melanin protects your skin from radiation, ionizing radiation and regular radiation. The minute I take an 11.5 water, soak a towel in it, put it on the chest wall that's been burned, in 5 minutes they feel better. It's like treating a burn, and that 11.5 water is excellent. It absolutely helps dramatically. And so what I do is I give them a gallon jug and I send them home, and they come back every 3 days and get a refill, and it helps. Now, that makes total sense to me because it absorbs those radicals that have burnt the skin and soothes it. I mean, treating a burn with cold water dates back, what, 1 million years probably? Yeah.
Fantastic. Now, another question from Michelle Jones. She said, in your studies, have you come across the use of Kangen water in the treatment of brain cancer? Considering the brain approximately 73% water, would it be beneficial in rebuilding the brain fast to drink both normal pH 9.5 and the occasional, perhaps a quarter cup of pH 11.5 water for treatment of it?
The reason I'm going to tell you this is a misleading. The question is not helpful because you're saying you're treating. Kangen water is not a treatment. It is a metabolite that we need. It is water that we need. It is a better water, but it treats nothing. It treats only one thing. I apologize. It treats thirst.
Yes, we get you. So we are basically more than 70% water. We have to drink good water. Therefore, it's Kangen water. It's not target to cure specifically any illness in our body, just to boost our immune system and set our engine right, and our body will begin to heal itself. Thank you there. Another question from Winston, one of our committee member. He asked, can someone undergoing kidney dialysis drink Kangen water? And if so, any limit they have to take note of?
Well, I think the reason that there has to be a limit on how much they can drink. First of all, they can drink all the Kangen water they want. As a matter of fact, I would encourage them to do that, and I can get back to that. But here's the thing, that when you're on dialysis and so on, you're always acidotic. And there's no water that's better than alkalized, ionized water to improve that pH. As a matter of fact, there are places in Europe now that use ionized alkaline water in the dialysis bath, and they get much better results from their dialysis because of the antacid effect. You know, it improves the acidity. So absolutely they can drink it. The only caveat is how much. Remember, some people on dialysis can make a fair amount of urine, which is great. They can drink more water. But if someone who can't make any urine, or is what they call anuric, where their body doesn't produce any urine, they have to watch how much they drink because they can't get rid of it, and then they go into congestive failure and they get water overloaded and have heart problems. So volume is the key. Kangen water, terrific. Good for them.
Thank you for that boost of confidence and raise our conviction on the amazing goodness of Kangen water. Now, last two questions, because I do not want to hold you up. I think it's dinner time for you. Ari asked, if a person who has low immune system since birth, does Kangen water help?
Probably. It would make total sense to me that it should, because of what we know so far, which is provable but still precious little. But I would like to do a study specifically on it. But I think that whenever you have better hydration, whenever you optimize, and one of the things that I think is often not stressed enough, drinking Kangen water kind of ought to make you more health conscious, so that, throw away the Cokes, throw away the, different, whatever the drinks they are. I don't drink. I drink two things. I drink water, coffee, and wine. I don't need Coke or whatever. So what I'm basically saying that, you should drink that water and it should make you better, but we need more information.
Okay.
We need more information.
Yeah, get you there, because we are not here to make claims. We are here to encourage everyone to drink the water that their body thirsts for.
Mm-hmm.
Last question, Dr. Horst, from Jason Ong. He said, some companies and recent research claims that it is the hydrogen in ionized water machines that gives the health benefits. And they claim that hydrogen water is better, because there's this hydrogen water machine around in the market. So what is your view on this?
Oh, my goodness. Yeah.
I get you.
Does anyone remember how you can do this little thing where you have your water machine turned on at a nice, kind of a low rate, and then you take a cigarette lighter and you see the little hydrogen popping?
Yes.
Okay. All right. That tells me that hydrogen is produced, we know that for fact, but that it is outgassed at a tremendous rate.
Yes.
Otherwise, you couldn't be setting it on fire, could you? Now, all the studies that have been done since 2005, there have been 100 plus diseases identified that benefit from hydrogen therapy. But how is that hydrogen administered? Guess what? Most of it by inhalation. Molecular hydrogen gets administered by inhalation. Another way to do it is to pressurize hydrogen into saline and inject it intravenously, but it is pressurized. The final thing is, no one knows for sure what the therapeutic dose for hydrogen is. So, could there be enough hydrogen in the Kangen water to be that beneficial? I do not know. I doubt it. Because, number one, we don't know the dose curve. We don't know how much we actually need. And we do know that it is a lot. Because when you inhale it, by the way, you can inhale hydrogen without any ill effects. You can inhale 20% hydrogen. You just gotta leave some oxygen in there so it gets it. But it's harmless, so it's symptoms. So my answer is, that's sort of, what is this clown's name? I'm sorry. Some young guy who thought I was nuts because I didn't believe that hydrogen per se is the thing, because I don't know, and nobody else does either. But outgassing is very good. It's like carbon dioxide. I mean, hydrogen just flies off the shelf, right, as it comes out of your lungs and everything else. So the answer is, I don't think so. I think there's too much outgas. I think it's the ORP. I think it's the pH. That's what I think. Now, we should study it. But we're going to find that therapeutic hydrogen is best administered through the lungs or through the veins under pressure.
Thank you very much for that clarification. So that was our last question. And I really cannot thank you enough for taking this time from Saturday evening in your time zone to share so much of your amazing knowledge. It's such a pleasure to have you here.